Hello, my name is Jennifer Chapman. I'm the Vision Therapy Administrator at FoxVision Development Center. I'm here today with Dr. Robert Fox, owner of FoxVision.
Hello.
And we're here today to ask some questions of Dr. Fox that I often get asked by parents and teachers. I want to let you know a little bit more about what we do here and what we're all about. Dr. Fox, you're a developmental optometrist. Can you tell us a little bit about what that means?
Okay, great question. We get asked that a lot. A developmental optometrist understands that there is a close connection between how a child uses their vision and how they're able to read and learn and attend in the classroom. And this understanding goes well beyond the typical just needing glasses to see or making sure the eyes are healthy, and really has to do with how well the eyes aim, focus, move, and especially how they work together when a child's looking at material on a printed page.
Okay. So how is a developmental optometrist in this kind of practice different from what most people are envisioning of an optometrist's office?
Well, number one, we've gone through a lot of extensive training. Most of us who practice developmental optometry have taken hundreds of hours of continuing education and workshops and classes beyond just what we learn in optometry school. And then to really show what we've learned, I myself and a couple of thousand of us across the country are board certified in vision therapy. We've had to take extra oral and written examinations to show that we really understand this connection well and can discuss it and treat to the highest possible level.
Okay. What we do here, you do comprehensive eye exams. Can you explain what that is and what kind of testing is involved in that kind of exam?
Okay, yeah. That's often the first thing people will find out when they call up for an appointment here. They'll get asked what kind of eye examination, because a comprehensive eye examination, which also you may hear the term learning-related eye examination. As I mentioned earlier, we do a lot more than just checking to see the need for glasses. We spend a lot of time just chatting with parents. Parents often have commented that the time we take just asking about the history and how many years and what kind of symptoms the child has when they're struggling at school. Just that discussion I have with the parents is often longer than many of the eye exams they've already taken. In addition, I myself will spend often a full hour with the child, testing again the focusing, eye coordination, ability to aim and use the two eyes as a team. We'll do some screenings of basic tracking and processing abilities. And then if we think this child may be looking at a program of vision therapy to treat the condition, we'll have them come back another day for perceptual evaluation as well.
Okay.
So.
Vision therapy. What is vision therapy?
What is vision therapy?
Yes.
Yeah, that's sort of self-explanatory, but then again, it's not. I'll talk about it, and people will ask me, is this something new? And I'll say, no, actually vision therapy goes back to the late 1920s. And once we diagnose and find a problem, we have to remediate it. And just as people get physical therapy to improve a shoulder that's not working well, or occupational therapy to learn how to do fine motor skills, we can actually teach a child how to use their visual skills to the best possible ability. We may start with some very, very easy tasks, just following a swinging ball or reading letters on a chart. And then as the child gets better, we'll challenge them and make things more difficult. We'll ask them to read letters while moving or balancing or standing on a balance board. And then when they have to keep track of words on a page, that's now an easy task for them, where before they couldn't keep their place through even a single paragraph on a page.
Yes, we love working with our kids. We're very passionate about working with children here, but I know we also do a lot of work with adults. Can you touch on that a little bit?
Okay. Yep, vision therapy is not just for kids. We'd like the world to know that. It's often understood by many to be thought to be just something for pediatrics or elementary school. So there's sort of two other populations we deal with. Number one, we have teenagers as well. Many of these probably should have been treated in elementary school, but did not, and they're struggling too. And some of them make amazing changes. We've seen kids' averages go up 20, 30 points in the course of a 9-month program of vision therapy. The other thing we do is we're seeing a lot of patients who have had brain injuries, and there's two categories of them. The first might be concussion patients. They might be school-age kids that have had sports-related concussions, or they might be adults that have been in automobile accidents or have had other types of trauma to their head for various reasons. The other population we see are patients that have had strokes, and strokes can really alter the ability of the brain to see and do things. They may lose the ability to use the two eyes together, or they may lose the ability to see peripherally off to one side or the other. The good news is we do help a great deal of these patients do well. We help a lot of these sports recovery children return to school and be able to perform, and we do help a lot of these adults that have had strokes and brain injury return to many of the tasks that they did before. Really tough. There's such a variety of them. It's case by case. Tough to really describe in a short video like this.
Mm-hmm. I think it's probably pretty understandable to most people how someone with an injury would need to come for therapy to correct it. But I do get a lot of parents that will ask me, well, if we just kind of let it run its course, will my child outgrow this and just mature out of it?
And that's really, really important. That's one of the reasons we're out here to try to educate people. Often by the time a child has come to us, they've been getting tons of intervention already. They've had tutoring, they've had psychological testing, they've had educational testing, they've had special ed, OT, PT, other types of therapies. And gosh darn, if the kid was going to outgrow it, he probably would have before he got in here. Very often, we're one of the last places people come and look. And it's the kind of thing that some children appear to outgrow it, and when you really talk to the parent, you find out, yeah, they just stopped reading. You know, they now avoid everything that they're, my kid doesn't complain about reading. Well, how often does he read? Does he read for pleasure? No, he likes to play ball. I go, well, you know, maybe he's given up reading for a reason. Also, we actually see things actually steamroll usually and get worse, because as the child goes from grade to grade to grade, now the print gets smaller and smaller and smaller, and now reading is even more difficult. And what used to be maybe a little bit of a problem where they're just struggling to stay caught up, now the child's really starting to fall behind in school.
So don't wait.
Don't
basically.
wait. Don't wait. Get your child evaluated.
It sounds like what we can tell people is that there's no age limit, and there's many, many different ways that we can help people with their vision issues.
Absolutely.
Okay. Thank you, Dr. Fox. If you would like to know more about what we do here at FoxVision, you can visit our website at www.foxvisiondevelopment.com. We're located at 1202 Troy Schenectady Road in Latham, New York, or you can reach us at the office at 518-374-8001. Thank you.
Okay, thank you.